cough is a reflex action, really. It's a reflex stimuli, a reflex action in which one, produces very forceful release of air, okay, to clear one's throat, and sometimes to actually eliminate irritants in the upper respiratory tract. One of the commonest causes is when you inhale smokes, irritants. Okay, somebody can cough as a result of that, just to clear one's airway. Diseases can cause cough. Diseases like lung infection, lobar pneumonia, bronchopneumonia. Chronic cough can be caused by TB, tuberculosis. All right. Somebody who smokes, a chronic smoker, can't come down with cough. Those who are asthmatic can also have cough. Yes, cough can be chronic. We talk of chronic cough when patient has been coughing continuously for 1 to 2 months, and this cough is not abating. Then you begin to, in fact, any cough more than 2 weeks, you should begin to get very, very much worried. By the time it's getting to 1 month, 2 months, this is a chronic cough. So you need to begin to look for causes. There's the dry cough, just what you talked about, in which patient is coughing but is not producing phlegm. There's also the productive cough, wet cough or productive cough. Okay, now the productive cough can also be subdivided. The productive cough, is dependent on what the person is coughing out. It can be whitish. If it's whitish, foamy, we call it frothy, then you say that, this is likely to be a heart-related cough. It can be yellowish. If it's yellowish, it's more pointing towards a bacterial infection. It can be brownish. Brownish cough are, cough that have, specks of blood that, stains the yellowish sputum. All right. It can be frank blood, pure red blood, or specks of blood in the sputum. Cough is a reflex action. All right. There must be something that is pulling the trigger. So what you need to do is to try and find out what the cause or the causes, as the case may be, is of the cough, and then you now treat. But a lot of people erroneously, when they start coughing, they would have taken many bottles of cough syrup. It doesn't really work that way. What you're actually doing is suppressing that reflex mechanism and suppressing one of the ways by which you can fight the cough. Hygiene is very important anywhere in the world. So, we've got to be quite, hygienic in the way we do things. Try as much as possible to, if someone is asthmatic, for example, try your best to make sure that the normal triggers that cause, the breathlessness and the cough, you try and stay away from such. And if you find out that you are getting into an environment where the trigger abounds, you try and withdraw. If you have somebody that is coughing beside you and who is not, coughing consistently or quite repeatedly, and the person is not covering his or her mouth and the nostril, quietly take a walk. Just move away from that sphere, because this infection can also be passed. If somebody has a chest infection, it can pass it on. Cough is not gender biased, it's not race biased, it's not age biased. So little children can cough, neonates can cough, infants can cough, do cough. So all we need to do is to look for the causes of cough, and then we deal with it. And in this era of HIV, lung disease and lung tuberculosis have also increased. If somebody discovers that he or she is immunocompromised, get to the doctors, let them start you on antiretroviral drugs, let them cancel you, start you on antiretroviral drugs, and then screen you for other potential causes of cough. And if you have it, start the drugs on time so that it will not cause damages.